You sleep 8 hours, you eat well, and yet, by noon, you are completely drained. Your head feels heavy, you can barely focus, and all you want to do is lie down. Sound familiar? That's not laziness. That's not just getting older. That's your body telling you something specific is off. Today we're going through 5 reasons why you might be chronically tired, reasons that almost never get checked at a routine doctor's visit. Stay until the end, because reason number 5 is the most overlooked one, and it might be the exact thing that's been draining you for years. Most people assume that if their hemoglobin is normal, their iron is fine, but that's not the full picture. There's a specific marker called ferritin, the protein that stores iron inside your cells. It can be critically low even when hemoglobin looks normal. What does low ferritin feel like? Constant fatigue, brain fog, difficulty concentrating, sometimes hair loss or brittle nails. The WHO estimates iron deficiency affects about 1/3 of the global population. Women are especially at risk, but so are heavy exercisers and people on plant-based diets. Ask your doctor to run a ferritin test specifically. You're looking for a level above 30 nanograms per milliliter. If you're below that, that's a conversation worth having. Reason 2 is vitamin B12, and it gets blamed on stress constantly, when the real culprit is sitting right there in a blood test. B12 is essential for your nervous system and red blood cells. When levels drop, you get brain fog, weakness, irritability, and memory issues. Who's most at risk? People eating mostly plant-based, people over 40, anyone on metformin or acid reflux medications. B12 deficiency builds slowly over months or years. People never connect the dots between how they feel and this vitamin. Get a B12 blood test. If you're under 300 picomoles per liter, talk to your doctor about high-dose supplements or injections. Reason 3 is your thyroid, specifically an underactive thyroid or hypothyroidism. When you go to the doctor with fatigue, they check TSH. If it's in the normal range, you're told your thyroid is fine. But the lab range is very wide. Some people experience real hypothyroid symptoms: fatigue, weight gain, feeling cold, slow thinking, dry skin, even when TSH is technically in range. Ask your doctor to also check free T4 and TPO antibodies, not just TSH. This gives a much more complete picture. Reason 4 is cortisol, your main stress hormone. In the right amounts, it gets you out of bed, but chronic stress breaks the system. The pattern many people recognize: wired at night, can't fall asleep, but in the morning, completely wiped out. That's cortisol rhythm inversion. Normally, cortisol peaks in the morning and drops by evening. Chronic stress flips that curve. Low when you need it, high when you don't. Fix your wake time. Same time every day, including weekends. Exercise in the morning, not the evening. These 2 changes alone can reset your cortisol curve. 8 hours in bed every night. You think you're doing everything right, so why are you still exhausted? There's a massive difference between time in bed and actual restorative sleep. Real recovery happens in deep sleep stages, slow wave and REM. Alcohol, even 1 glass of wine, suppresses REM sleep. You fall asleep faster, but spend less time in stages that actually restore you. Phone before bed. Blue light delays melatonin, pushing deep sleep later into the night, right up against your alarm. Inconsistent sleep timing. Your biological clock never fully calibrates. You end up spending 8 hours in bed, but only 4 in real recovery. Put your phone away 60 minutes before bed. Cut alcohol at least 3 hours before sleep. Pick a wake time and stick to it 7 days a week. 1. Low ferritin. Get it tested separately from your regular blood work. 2. B12 deficiency, especially if you're over 40 or eat mostly plants. 3. Thyroid. Ask for free T4 and TPO antibodies, not just TSH. 4. Cortisol dysregulation. Fix your wake time. Move in the morning. 5. Poor sleep quality. Ditch the phone, cut the nightcap, lock in your schedule. Start with labs. Ferritin, B12, TSH with free T4. That'll tell you where to focus first. Let me know in the comments, which one of these is yours? Or is it all 5? Hit the like button if this helped. Subscribe for more plain English health videos. Take care of yourself. See you in the next one.